A buttock augmentation by fat transfer may last approximately 1 to 4 hours, depending on the complexity of the procedure and whether an additional procedure is performed at the same time. Your surgeon will carefully mark the areas where fat will be removed and the areas where fat will be injected. These markings will be used as guidelines during the procedure. Fat transfer may be performed under local anesthesia, where only the surrounding area is numb. Alternatively, for procedures involving large or multiple areas of the body, you may be asleep under general anesthesia. A special medicated fluid called tumescent fluid is injected into the areas that will be treated with liposuction. This fluid expands the tissues to make it easier to remove fat cells, numbs the treatment area, and minimizes bleeding. Once a large volume of tumescent fluid is injected into the treatment area, you will rest for several minutes while the area becomes completely numb. Your surgeon will begin the procedure by using liposuction to harvest your fat. Excess fat is removed from areas of the body including the jowls, abdomen, back, thighs, and buttocks. Most body fat is located on top of muscle tissue, just beneath the skin. Liposuction works by surgically removing excess fat with a suction device, resulting in improved contours in the desired area. Depending on the location of the procedure, your surgeon will make short incisions along natural creases of your body in order to easily conceal scars. Your surgeon will insert a small tube-like device called a cannula. Using a forward and backward motion, small tunnels are created in the fat layer, removing the fat with a gentle suction. The tunnels will collapse over the next few weeks, resulting in new contours in the specific treatment areas. For more information on the liposuction procedure, please view our liposuction animation. Next, the undamaged fat cells that were removed are isolated, cleansed, and prepared to be injected into the buttocks. Some surgeons may prepare the fat with stem cells before injection. Then your surgeon will use a cannula to inject the fat cells into your buttocks. Using a forward and backward motion, fat is slowly added in multiple areas until the desired volume is achieved. The incisions may be closed with sutures or may be left open. Surgical drains may be inserted in order to help prevent fluid buildup. Lastly, absorbent pads are applied to protect the incision site as you heal. Most fat transfer procedures are completed in outpatient surgery facilities. You should be ready to go home the same day, usually within 2 to 4 hours. You will likely need to wear a compression garment for a few weeks to provide support, minimize swelling, and help the skin conform to the new contours of the body. You may also be prescribed medication to manage your pain for the first few days and as needed as you heal. It is a good idea to allow yourself several days to recover before resuming your daily activities. Pain and bruising after the procedure are normal and typically will fade within a couple weeks. Swelling also may occur and should subside within several months. If surgical drains are present, they along with any bandages will likely be removed within the first week following surgery, while any non-dissolvable stitches may stay in place for 7 to 10 days. Be sure to follow your surgeon's recovery plan, including sitting and sleeping position restrictions in order to avoid complications and allow your body time to heal. Consult your surgeon regarding risks such as cysts, infection, small mineral deposits called microcalcifications, and death of fat cells. You also may need to discuss options for future fat transfers, as it may take more than one procedure to achieve your desired look. While you will most likely notice an improvement immediately after the procedure, final results will not be apparent until 1 year after surgery.